Hi there, Dr. Erickson here. For the next couple minutes, I want to discuss with you information about the topic of peripheral neuropathy. Now, if you found my video, there's a very good chance that either you or someone you loved and are concerned about is suffering from this debilitating metabolic and neurological condition. To date, there are some 20 million people who are dealing with peripheral neuropathies, and unfortunately, the outlook is not very good. However, there is some new information that you need to know about, and I'm going to cover that with you in this video. So what I recommend is that you grab your loved one, grab somebody close to you, and sit down and watch this video multiple times if necessary. Soak in the information that I'm going to share with you because you have some important decisions to make at the end. Now, peripheral neuropathy for many people has the debilitating symptoms of lots of pain in their feet and possibly their hands. Many times it's been described as, I feel like I'm walking on broken glass. Or, I feel like I have sponges on the bottom of my feet. I can't quite feel things like I should or like I used to, or my sock feels bunched up under my toes or the arch of my foot. For other people, they may say they feel like they have sharp, burning knives stabbing in and out of their feet, the intensity of the pain. And for others, it may be the absence of pain. I'm numb. I don't feel sensation in my feet. The interesting thing is that even though they don't feel the perception of their socks or their shoes or the ground, they still can feel pain. Kind of an interesting situation there. Needless to say, though, peripheral neuropathy is very debilitating. And for many, without addressing the real cause, which we're going to get into today, what you need to know about that, but for many, the prognosis is not good at all. They are not going to get better. They will continue to get worse. So today, let's break this open. Let's talk a little bit more about peripheral neuropathy. Most of the patients that come into my office, and if you're like them, you'll have a similar experience. You've been to multiple doctors, physicians, care practitioners. They've either recommended medications to you, maybe they've recommended surgical procedures like a tarsal tunnel relief or some other types of procedures. Only to find that these solutions don't give you the results that you want. Either they're just managing conditions, either you come away with a concern for added medications and side effects, or the percentage of success of the procedures is just not worth it to you. Now, on the other hand, the flip side of that, many people have gone to their doctors after multiple doctors and they have been told, well, there's nothing that we can do with it. You're just going to have to learn to live with it. Or they've been told it's in your head. Now that's a crime and that's not true. Or they've been told it's part of growing old, as we see that many of these neuropathy issues tend to target those who are a little more mature. So the excuse is, well, you're just growing older. That's the way it is. Unfortunately, this leads to frustration, this leads to disappointment, this leads to anger, as people are struggling to manage these symptoms and watching the quality of their lives literally slip between their fingers. Now, something I want to be very clear with you at the very beginning. I am not a medical doctor. Okay, I do not recommend medication. I cannot. I will not. And I do not also do surgery. I'm an alternative care doctor, a chiropractor by training, but I have done a lot of additional training and education on the topics of neurology, function of the nerves and health of the nerves, metabolics, how the body functions, how disease processes can affect the body and where they can begin in. Also anatomy, physiology, and nutrition. All of these things I'm going to roll into this because they're all critical components if you want to have the opportunity of possibly undoing the symptomatology that you're dealing with your peripheral neuropathy. Now, my focus with all of the clients who come in is to focus on you as an individual. I want to know how your body is functioning, and if it's not functioning right in certain areas, those are the areas we need to begin to work on. Because the reality is that you do not have a neuropathy problem. You have a health problem. And we have to get to the bottom of your health to find out what's keeping your body from functioning optimally, and that, my friends, is what we have to work on. Okay? Something in your life, something in your body is not working properly, and it's allowing the nerves to begin to die and wear out. That's what's leading to your symptoms. Okay? We're not interested, let me back up. I am not interested in chasing around your symptoms. That is what you have been doing up to this point with the medications and the other things that you've been doing. I am interested in fixing problems, and that's where we go with this. Very shortly here, I'm going to get into how I'm different and how we actually help people get over their neuropathy problems. But I want to cover some more information about neuropathies with you. Forgive me if this is a little bit basic, but I need you to have the understanding. Many people haven't had this. There are 7 indicators of neuropathies, of peripheral neuropathies. Okay? Number 1, there can be numbness. Number 2, there can be burning feet. Number 3, there can be cramping in the feet or the leg muscles. Number 4, there can be a sharp electrical pain, sometimes like a stabbing or shooting pain that can be experienced. Number 5, pain when walking. Number 6 is there can be difficulty sleeping due to leg discomfort. And number 7, a prickling or tingling feelings in the feet. Now, I've mentioned most of these in relationship to the feet. The reality is that they can happen in your hands as well. Now, a neuropathy is a condition where the nerves have begun to dysfunction. They're wearing out, they're dying, they're sick. So the nerves basically are not sending the messages to and from the brain like they're supposed to. And so you're receiving information that's incorrect or it's garbled. That's what is interpreted by the brain as pain or numbness or an altered perception of where your feet is balanced, etc. Let's talk about neuropathy. What does that mean? Neuropathy, the neuro part of neuropathy means nerve. Pathy means abnormal function. So neuropathy is abnormal functioning of the nerves. Peripheral is the periphery or the outside of the body, the farthest away from the center. So a peripheral neuropathy means nerves that are damaged or dying that are the farthest away from the center of the body. Now I need you to pay attention to this next point. This next point is very, very, very important. And that is that 10% of the nerves in your body carry pain sensation. That means that those 7 things that we just talked about with you, most of those are dealing with perception in your body. Those are going to be part of those 10% nerves that can pick up those things. That means, though, the other 90% of the nerves in the body are passing and receiving information that you aren't perceiving as pain, but there could be something seriously wrong with them and you may never know. Okay? You may never know. So the idea that you have this slight numbness in your feet or your hands or you have some unsteadiness because you can't feel your feet, in many instances, and again this is important to get, in many instances those sensations literally are the tip of the iceberg, and there is a lot of other things going on below your level of awareness that you're not interpreting because it's not a pain signal that can literally be contributing to the demise or the downfall of your overall health. So peripheral neuropathy, summing up so far, is nerves that are dying or damaged in the farthest reaches of the body. Typically it starts with our feet. More progressive natures, or progressive problems, we start to see them in the hands as well. Now depending on the type of nerve that is actually damaged, you will understand the type of symptomatology that you're dealing with. So let me rephrase that. So depending on which type of nerve is actually receiving the damage or the neuropathy, that is going to be the determining factor of what your symptomatology is. So let me go over these 3 nerve types. The first one are sensory nerves, and these are the nerves that actually carry sensations such as pain. So they can be burning sensations, nerve pain, tingling, numbness, the inability to determine joint position. These would all be characteristics of the sensory nerves becoming damaged. The second one is these are the nerves that control muscles, or are called motor nerves. And so damage to motor fibers will interfere with muscle control. This can lead to loss of muscle bulk, weakness in the muscles, the legs, and loss of dexterity. You're not quite as balanced and as able and capable as you used to be. Sometimes cramping also can be an indicator with this. Some other muscle-related symptoms could be difficulty swallowing, difficulty in your ability to move a certain part of your body, such as in a paralysis, falling, or the legs buckling or tripping over things, lack of dexterity, lack of muscle control, lack of muscle tone, or muscle twitching and cramping. The third one that I want to talk to you about are the nerves that carry information to and from your organs and your glands. This is called the autonomic nerves. Autonomic means automatic. They function in the background. So damage to these nerves can often be the silent but deadly type of symptoms. The autonomic nerves will control involuntary structures such as those inside the organs or even high blood pressure. So damage to these nerves can cause symptoms such as abdominal bloating. How many people don't have abdominal bloating? Blurred vision, constipation, diarrhea, difficulty in your ability to sweat, dizziness that occurs when you stand up, or fainting if you change positions too quickly because of a fall in blood pressure, heat intolerance with exertion, male impotence, feeling of incomplete bladder emptying, nausea or vomiting after meals, or even incontinence. Sadly, Western medicine, we're so focused on treating symptoms that these symptoms of autonomic or these autonomic issues usually are treated as if the symptoms are treated. They're treated as a completely separate entity. And unfortunately, they're often overlooked and minimized. And hardly ever, if ever, are they ever tied into a possible cofactor in here with somebody who's struggling with a neuropathy as well. So where do neuropathies come from? Well, there's a variety of different things that can actually lead to neuropathies. For some people, it could be an old injury that you had to your back, which could cause arthritis or a blown disc or a narrowing called a stenosis of the spine. For others, it can be caused by a metabolic disorder, such as diabetes type 1 or type 2. See, your brain and your nerves only operate on two forms of fuel or energy. One of those is oxygen and the other is sugar. So if you have problems, fluctuations in blood sugar, or blood sugar that's too low, or blood sugar that's too high, you run the risk of depriving your nerves